Okay guys, so thanks so much for tuning in today. We've got a special talk today on dancers and foot and ankle injuries. We have so many, we probably can't get through all of them. We might have to make another video, but dancers are quite amazing athletes. They put their foot through an awful lot of amazing positions, and so we're going to go through a few of the problems they can have as a result of this. Now, the foot and ankle of a dancer is particularly vulnerable. Almost 100% of them get some sort of musculoskeletal injury throughout their career, and almost 40%, so 4 out of 10 are related to the foot or the ankle, so that takes up a lot. So we're going to go through some of the common conditions that we see. Now, this photo here is a person that's on point. It's just an example of one of the unnatural positions that ballet dancers and dancers in general get themselves into. And you imagine the amount of force there that's being put through the toes. So the very first condition we're going to talk about is called posterior impingement. Now, posterior is the medical term for at the back. So it's pain around the back of the ankle, and it's usually worse when the patient's in an on-point position or a demi-point position. Now, this foot's sort of neither, but we're just going to use the arrow to point out where the patients get pain. And impingement basically means that the soft tissues, the tissue at the back there is either getting squeezed or trapped because of the position of the foot. You know, dancers are constantly in this position more so than the rest of us, and so the area gets inflamed. Now, as an example here, this is an x-ray of your ankle. It's a normal ankle. We're going to point out the heel bone there. We're going to point out the shin bone, the big bone called the tibia. I'm going to point out the bones of the foot. And then your toes are sort of off to the left of the screen because we've cut you off, unfortunately, in this x-ray. But we're just going to look at the position we're going to focus on is that area that we've just drawn in yellow, the tissue at the back. Now, this is an amazing x-ray of a ballet dancer on point. But we see that the same area there is much smaller. It's getting squeezed when the patient's in that position, and that's the problem that we encounter because that tissue just constantly gets squeezed and it gets inflamed. And so people present to us with pain at the back of the heel. Now, to make matters worse, some of us are born with or develop a little pebble in the back of our ankle called an osteogonum. And we often find this incidentally on many patients that we see. But in dancers, this is a real problem because that tissue is already getting squeezed, and then you're going and squeezing a pebble, so a pebble piece of bone there as well. So you can see here, this is the dancer up on, pushing their foot down, and the area there is getting really squeezed. And in addition, there's tendons around the back there, and the main one is the tendon that sort of bends your big toe down called the FHL, and that can often get squeezed, and patients can present to me with pain over the big toe as well. Now, the management for that usually is what's called arthroscopy, and we take down some of the inflamed tissue, and usually you're out for between 6 and 12 weeks. Now, the next condition we're talking about is called anterior ankle impingement. So that anterior means the front of the ankle, and impingement once again means a squeezing of the tissue. And so this is on the opposite side of the ankle, it's at the front, and this is your foot in the normal position. And patients often get pain when they move the foot up, so bending the foot up, and the pain's over that area in red. Now, usually in ballet dancers, it's doing a move called a demi-plie. And please excuse me if I butchered the pronunciation of that because I'm not a dancer, unfortunately, but that manoeuvre requires you to bend your ankles up. Now, this is an x-ray of the ankle looking at it from the side, and what we're going to point out here is that little nubbin of bone at the front there. It shouldn't be there. And what happens is when you bend your ankle back, the other bones in the foot, they knock against that front part of the ankle, and that's what causes the pain. Now, the only way to get rid of it is through keyhole surgery, so an ankle arthroscopy, where we shave off the excess bone, and then we get the patient lots and lots of physiotherapy to get the movement back and feel comfortable. And hopefully we can get most people back between 5 and 6 weeks, but everyone's a bit variable, and the swelling takes a lot longer to go down. But this is a common presentation, not just in dancers, but in football players as well. Now, there is something called a dancer's fracture. It's very unique to dancers. It involves a bone called the fifth metatarsal, and that's the bone that lines up in line with your little toe. We're going to point out the fracture here in the arrow, and it's usually due to a dancer that's missed their jump, or they've rolled over their ankle on the outer border of the foot when doing a demi-point position, so they're up on their toes generally. Now, the good thing is this fracture usually doesn't need surgery. It can be treated in a moon boot, where you can get around full weight on the foot and the ankle for about 5 to 6 weeks, and then we wean you out of the boot. Now, if you're pain-free and there's good bone healing there, then during that time we're hitting you with lots of aggressive physiotherapy, where you strengthen some of the tendons around the ankle, and also look at something called proprioception, which is knowing where your foot is in space, and that generally works quite well and people recover very well. But there is another type of fracture called a stress fracture, and this is because dancers work really hard, they're really motivated, and that's it on the MRI, and we'll show you in a sec. And it's more difficult. It's usually a dull pain that you feel during class, usually while you're dancing, and it often progresses, gets slowly worse, so that it's more common in everything you do day to day, pain at night when walking, things like that. But it usually sort of starts as a niggling pain, and it's very difficult to describe for the dancer when they come to see us. Now, what is a stress fracture exactly? Well, if you read a book, it says microscopic injuries where the bone is subjected to maximal stress. And you're like, well, okay, what does that mean, right? It makes no sense. A whole lot of medical jargon, difficult to explain. But what it basically means, and we're going to write it up in a sec here, is that it's an injury that nobody can see, doesn't really get picked up on x-ray, keeps happening over and over to the bone, and it weakens the bone, but it's not enough to do a big crack. It's just a little crack within the bone, so it's this constant stress that causes a weakening of the bone and then causes pain. Now, there are factors that increase your risk of having this, and unfortunately, female dancers are more likely to develop this type of stress fracture than male dancers. In addition, if you're really dedicated, you earn more than 5 hours of dancing a day, that's going to increase your risk of having this type of injury, unfortunately. Now, in terms of where the pain is, this is a front x-ray of the foot. The fracture is usually in that position where the x-ray is pointed the arrow, but here in red is where you'll feel the pain on your foot, usually. It's worse than any weight bearing more often than not, but it is an injury that is difficult to describe, right? Nothing major happens, it's just due to overuse. It'll be vague. The x-ray will often be normal, and so we need to be really vigilant about this. If I see a dancer, it's an injury that's unique to dancers, and I'll often investigate it further. So if someone tells you it's all normal, it'll go away, it's probably worthwhile pushing to look further. Now, this is the injury here on an MRI. So it's where that white stuff is there. It's difficult for me to point out exactly, but fractures in other people for other injuries usually are further up where that red area is. But the fracture in dancers is where that white arrow was. So the treatment for this is also very likely to be what we call non-operative, so not surgery, and unfortunately for dancers this means rest, sometimes between 6 and 12 weeks. We use that boot again for at least 6 weeks, and you need time off dancing. It needs to be pain-free for you before you can get back to dancing. So these are a couple of injuries in dancers. We'll have to do another video because there's so many, but for more information look us up on www.hunterfootandankle.com.au. Thanks.